Dr. Resrava. Today we'll talk about vitamin D, and we'll also talk about its connections with skin color and COVID-19. So the primary source of vitamin D is sunshine, over 90%, but it has to be direct exposure. So getting sunlight through a window or a sunroof will not be able to convert that into vitamin D for you. Also, it has to be sun exposure after 10 a.m. and before 3 p.m. So the early morning stroll or the evening walk does not count. About 10% of that can be derived from food. However, the type of cooking also matters. So as an example, if you're trying to get it from fish, frying the fish would reduce it by 50%, while baking it would preserve the amount of vitamin D in it. It's rare for us to see severe cases of vitamin D deficiency, but in most cases, we're seeing mild to moderate cases, the most common symptoms being tiredness, fatigue, general aches and pains, neck, back, lower legs. And there may be this overlap with the kind of lifestyle which can predispose to it. So, sitting on a chair in front of a screen all day and the effect that'll have on your spine, on your neck, on your, the weakening of your core stabilization muscles. So that's the kind of symptomology that we come across. Of course, vitamin D has several roles, including bone strength, muscle strength, reducing inflammation, reducing risk of cancer, cardiovascular disease, and certain types of neurological conditions as well. Here in the blog, and I'll put links to the blog and my YouTube channel with a longer video with a nutritionist in the description below. We talk about its relationship with certain types of neurological conditions, the kind of method of treating. Usually with severe deficiency, I would give a high dose for about 100 days. Typically here, I would give 5,000 units a day for 100 days, followed by a maintenance dose, a lower dose for maintenance. There are certain conditions which reduce your vitamin D absorption capability. So increasing age, darker skin color. It's a fat soluble vitamin. So obesity itself will reduce the amount of vitamin D available to you. Even high fructose corn syrup. And we talked about this in a separate blog where we talk about an anti-inflammatory diet. This is a pro-inflammatory agent, usually a preservative, also reduces absorption of vitamin D. And here we talk about how vitamin D is also linked with certain kinds of increase in infective respiratory conditions.